Hello, everybody. This is Steve Smith from WCG Patient Radio. WCG focuses on clinical trials and the ethical treatment of people who volunteer and the safety and efficiency of those trials so we can get more medicines for unmet medical needs. Today we are speaking with Mr. Thomas Farrington, a software entrepreneur, a theater producer, an author, and a prostate cancer survivor who founded the nonprofit organization called Prostate Health Network that educates men nationwide about prostate cancer and prostate health. His advocacy spans a wide range of approaches from educational seminars, a much visited website, a theater production now on tour, and visits to legislators on Capitol Hill to help shape public policy for the benefit of people with this unmet medical need. Mr. Farrington serves as a trustee of the Dana Farber Cancer Institute and as an advisor to a number of other healthcare organizations and programs. And he is on the National Comprehensive Cancer Network's Prostate Cancer Treatment Guidelines Panel and their Prostate Cancer Early Detection Guidelines Panel. Hello, Thomas.
Good morning, Steve. How are you?
Very good. Thank you. Thanks for joining us today. You started the Prostate Health Network in 2003 following the treatment in the year 2000 that you had for prostate cancer in order to provide education about prostate cancer for African American men who suffer from prostate cancer in higher amounts than the public as a whole. Tell us what you were up to career-wise and otherwise in life before diagnosis and how prostate cancer became part of your world.
Yes, Steve, I was a computer software entrepreneur. I began a company in the early stages of kind of the computer revolution. I founded my company and put computer services in 1969 at the age of 25. I founded this company in Harvard Square, Massachusetts, and and I worked in that field, leading that company and doing some other things as well for 30 years. This was a great career. I enjoyed it. It gave me lots of good experiences here in this country as well as nationwide because we did have international operations. So this is how I have spent pretty much my career and my life dedicated to entrepreneurship and building a business.
And prostate cancer has run in your family, right?
Yes, I lost my father to prostate cancer 3 months before I was diagnosed. I lost my father Christmas Eve of 1999. I was diagnosed in March of 2000. In early years, I had lost both my grandfathers to the disease. And Steve, unfortunately, through all of these losses, I was not aware of my risk for prostate cancer. My lack of knowledge, I found very alarming when I was diagnosed.
And so how did your diagnosis come about, and how did you respond to it? What did you do? What was that like?
Well, my diagnosis came about from a physical exam where I had a PSA test and a digital rectal exam. My PSA was high, and my primary care doctor suggested that I have a biopsy. When I had the biopsy, it was found that I did indeed have prostate cancer. And I had prostate cancer at an intermediate level. But because of the family history and the death, I was very, very concerned about my overall condition and what my outcome could be.
And did you get a treatment, and what did that do for you?
Well, it's very interesting. My treatment journey is one of where I initially decided that I would have surgery based upon my conversation with the urologist. And I was set to have surgery. Well, I pushed surgery off a few months so I could watch my youngest child graduate from college. So I wanted to be a part of that. But while I was spending this time waiting, I began to do a lot of research about prostate cancer. Things that I had not known, I began to dive into in a lot of depth. And when it came time to have my treatment, my surgery, I became less and less convinced that this was the right decision for me. Again, I did not have any prior knowledge. I was literally frightened when I was diagnosed after losing my father, and so I accepted the treatment, the first treatment that was presented to me. But as I began to do my research, I became less and less convinced that this was the right approach. So the day before I was to check in the hospital for treatment, I literally walked away from all of my doctors and said that I am not going to take this treatment at this time. I may take it at some later time, but I'm going to take time to complete my research and fully understand what my treatment options are. So after taking that time, and it took me a couple of 3 months to do that. And after that, I did end up taking a completely different treatment than the one that I had planned to take. And this treatment literally took me out of town. I'm in Boston, where we have a lot of medical institutions, great medical centers, like the Dana Farber Cancer Institute that I serve on the board now. But there was a treatment that was actually in Atlanta, Georgia, that was a dual radiation program that was only offered by that center. And I chose this treatment over surgery because when I looked at my staging of where the cancer was at that time, there was a good chance that it had spread outside of the gland, and even my doctors talked about that. So I decided to go a different route than surgery.
And did that work for you?
Well, it worked in many ways, Steve, because while I was there for this treatment, there were men there from all over this country and from other parts of the world for the specialized treatment, and I got to know them, and we shared stories with one another. In fact, I stayed at a American Cancer Society facility with them at a Hope Center, and we talked day and night. So the longer we spent time talking, the more we learned. So I decided that I would write a book based upon our experiences. So I convinced these men to let me interview them, and sometimes their wives, to get their story and put it in a book, such that other people could learn from our experiences. They were a little bit concerned initially whether I knew anything about writing a book, because I had never written a book, but I did this and put the book together and published it a year after I completed treatment, called Battling the Killer Within.
Yes, that book is titled, you were just saying, Battling the Killer Within.
Yes.
And Winning, right?
Yes. Now, Battling the Killer Within. And then in 2005, I released that book in 2001. In 2005, I updated it and with a new book called Battling the Killer Within and Winning.
I see. You also then, from this experience, you have shared this with many other men through your not-for-profit group called the Prostate Health Education Network. And this has resulted in a nationwide network of people who are cancer survivors and their families who also now educate others and support them. Tell us about the Prostate Health Education Network.
Yeah, see, when you asked me whether the treatment worked, I think I answered it worked in a number of ways. And one of the ways was that by spending the time away from home, I had more time, literally free time, than at any time, I think, up until that point in my life, because this was a treatment for 7 weeks. I had never taken a 7-week hiatus. So it gave me a chance to write the book, which led me into advocacy. And so after writing the book and speaking, I founded the Prostate Health Education Network in 2003. And from that, one of the very first things that we decided to do was to pull together a network of survivors around the country so that we could work collectively to educate our communities about the disease. Because again, for Black men, this is the leading cause of cancer and the second leading cause of cancer death. So this network of men around the country still work. We work together today, and it's been the basis and foundation for all the other initiatives that we now have undergoing.
And what is your? How do you educate the public and this community of men so that they are more aware and can take more action to preserve their health? What are the programs like?
We do a number of initiatives. I was able to bring in the Dana Farber Cancer Institute as a partner right after I founded Finn, and they are one of our major partners till this day. And I might say, Steve, that March 2020 is my 20th anniversary as a prostate cancer survivor. So I feel very, very blessed to be here and to be able to continue this work. But working with the Dana Farber Cancer Institute, we pulled together monthly meetings there and converted those, turned those into monthly webcasts that we now share across the world. Our webcasts, we stream them live over Facebook. We reach each month in an average of 5,000 unique visitors, sometimes up to 10,000, depending upon the subject matter. So this is one of our very key initiatives. We also created church partnerships around the country so that we will have a physical base and a support base in the cities where we could educate our network and other people. So working with our church partners, we first began a Father's Day rally where we had it one day. We asked churches to recognize the survivors and their family members on Father's Day and have them come forward for prayer. And one of the interesting things about that, Steve, is that what we saw, what came out of that, is that many men were in church together, may have been sitting next to each other, not knowing that they were both survivors. So by having them come forward and receive prayer and hold hands, they realized that they had people within that church where they could coalesce and reach out to the church and other parts of the community. So from that, we then created educational symposium where we would pull together medical experts to go to these churches for a 4-hour event. And we would tackle different aspects of prostate cancer, from early detection, the types of treatments, clinical trials. And so this is something that we continue today. So the webcast, the Father's Day rally, the symposiums, part of our foundation programs. We also, in 2005, began a African American Prostate Cancer Disparity Summit. So we pulled together members of the Congressional Black Caucus and asked them to join with us in our outreach efforts. So each year during the Congressional Black Caucus annual legislative conference, we have a 2-day conference, usually one day on the Hill and the second day at the Washington Convention Center as part of the Congressional Black Caucus events. This will be our 16th year that we've held that summit. We bring together legislators, we bring together industry leaders and survivors and community leaders to talk about initiatives that we can undertake collectively to move the fight against prostate cancer further along. And in 2018, we decided that our symposiums had been successful enough But we felt that working with the church community and some of our cancer centers around the country, that we could actually do more, bring more people together. So we worked with a playwright to create a play that would educate through entertainment. This play, Daddy's Boys, uh, we launched in 2018. We've been to 14 cities, and it has been received overwhelmingly. Um,
Yes,
and
this is really remarkable. I want to make sure that our listeners catch the name of the play and the fact that they still have opportunities to see it. It's called Daddy's Boys, right?
Daddy's Boys, listeners can go to daddysboys.org to find out more about the play and when it may be coming to your city. We are kicking off our 2020 tour in Durham, North Carolina, in partnership with Duke Cancer Center and UNC Cancer Center, two NCI comprehensive cancer centers, and with a number of our church partners and a number of our survivor networks. We kicked that off on this month, March the 21st, 2020. We will have over 1,000 people. The capacity for the theater, the Carolina Theater, is 1,000. We have more than 1,000 registered as of now. Then we moved to Philadelphia, we moved to Chicago, and we will announce our other cities as we move these along. But what we've been able to do with the play is to have people come and enjoy an entertaining experience. It's a drama, a comedy, and a musical. But we get our messages across about prostate cancer through the script, and we also have a panel discussion at the intermission of the play. So this is
really
something
remarkable that you've made a form of entertainment that is engaging and people want to watch, even with comedy and music, which is what people want to be doing with their lives, is enjoying themselves. But you're delivering a very important message. It doesn't always have to be clinical and technical and grim. So that's a wonderful thing.
Absolutely, it works well. It's been very effective to bring the community together to educate about prostate cancer.
So the dates I know for Daddy's Boys, you mentioned Durham, North Carolina. That's the 21st of March. Philadelphia is April 18th, and Chicago is on May 2nd.
These 2nd, are all in that's 2020. Right.
Mm-hmm. And in Philly, it's at the Church of Christian Compassion. Is that correct?
That's right. Church of Christian Compassion, a mega church in Philadelphia with 3,000 seating capacity. In Chicago, we go to the DuSable Museum. We have 2 performances there on May 2nd.
And in Durham, it's at the Carolina Theater.
It's at the Carolina Theater, yes.
Well, it's really remarkable how you have created a nationwide network of supporters who help others and educate. You've collaborated with Dana Farber Cancer Research Institute so that there is this strong professional medical and scientific component to what you're doing. You regularly visit legislators on Capitol Hill to influence public policy, which is so important. And you also have the entertainment and creativity. I think many people would find it quite remarkable and inspiring that you've been able to take your experience and transform it into such a multidimensional way of helping.
Well, it's been a journey, Steve. It's been a journey of discovery. So with each initiative, we are enlightened with new information, new ideas, and we try to move on those. Our mission is to eliminate the African American prostate cancer disparity. We die at a rate over twice that of other men from this disease. So we're committed to doing our best to find answers as to why and to help solve this issue.
So would I be right that one of the reasons for that health disparity is the one that you're addressing, which is education and encouragement of all the stakeholders to include African American men in their own education, to inform them, to invite them in, and for them to collaborate with each other to pass those messages around that knowledge can actually help make a difference?
Well, our theme is knowledge is the best defense against prostate cancer. And I speak from personal experience and other men that we see. We try to make sure that they have enough knowledge and information to make informed decisions that's right for them. When I decided that I wasn't going into surgery when I was initially diagnosed, and when I walked away from all of my doctors, not only my urologist, but even my primary care doctor, said, "Well, Tom, I don't think there's anything I can do for you at this point." I was alone trying to find information, and we're trying to make this information available to men and their families so that they can learn and make the best decision for them so that they can beat prostate cancer.
Yes, this is wonderful because collectively we are not alone, but it's quite common for people to say upon receiving diagnosis they were felt alone and were alone. So thank you for speaking with us today, Thomas Farrington. We really appreciate that, and I think a lot of people have been helped by what you do, and it's wonderful to know more about it. Thank you very much.
Steve, thank you for this opportunity.
This is WCG Patient Radio. We've been speaking today with Thomas Farrington, founder and president of the Prostate Health Network, about prostate cancer and prevention. To go to that website, you can go to prostatehealthed.org. That's prostatehealthed.org. Thank you for listening, everybody. Goodbye.